Today we will be discussing the posture. Posture is the position or altitude of the body either with support during muscular inactivity or by means of coordinated action of many muscles. Acronym for each reference: P. Pelvis is neutral with weight distributed. O. On the whole foot. S. Stable joint. T. Tight abdominals. U. Upright ribs. R. Retracted shoulder. E. Air over shoulder. Types of postures. There are two types of postures: inactive posture, active posture. Active posture include static postures and dynamic postures. Inactive postures: attitude adopted for resting or sleeping. All essential muscular activity reduces to minimum. Used for training general relaxation. Active postures: integrated activity or action of many muscles is required to maintain active postures. It may be either static or dynamic. Static posture: the body and its segments are aligned and maintained in certain position. Constant pattern of posture, that is standing, lying and sitting. Dynamic postures: the body and its segment are constantly modified and adjusted to meet the changing circumstances which arise as a result of movement, that is walking, running, jumping, throwing and lifting. Posture assessment: the spine has three natural curves at your neck, mid upper back and lower back. Correct posture should maintain these curves but not increase them. The line of gravity should pass through the specific points of the body. This line should pass through the lobe of ear, the shoulder joint, the hip joint, through the greater trochanter of femur, then slightly anterior to the midline of knee joint, and lastly anterior to the lateral malleus. When viewed from either the front or the back, the vertical line passing through the body center of gravity should theoretically bisect the body into two equal halves. While assessing posture, symmetry and rotation tilts should be observed in the anterior, lateral and posterior views. Assess head alignment, cervical, thoracic and lumbar curve, shoulder level symmetry, pelvic symmetry, hip, knee and ankle joint. The postural mechanism. The postural mechanism involves the muscles and nervous control. Muscle action in posture: neck flexors and neck extensors are active. Erector spinae is active, counteracting gravity pulls forward. Iliopsoas is constantly active. The abdominal muscles remain quiescent, although the lower fibers of the internal oblique are active in order to protect the inguinal canal. Gluteus maximus is inactive. Gluteus medius and tensor fasciae latae are active to counteract lateral postural sevae. Quadriceps and the hamstring generally not as active. Gastrocnemius and the deep posterior tibial muscles are less frequently active. Soleus is constantly active because gravity tends to pull the body forward over the feet. Tibialis interior is less active unless high heels are being worn. The intrinsic muscles of the feet are quiescent because of the support provided by the ligaments. Nervous control. Postures are maintained or adapted as a result of neuromuscular coordination, the appropriate muscle being innervated by means of very complex reflex mechanism, the postural reflex. An afferent response to an afferent stimulus. The afferent response in this instance is a motor one, the anti-gravity muscles being the principal effector organ. Afferent stimuli arise from a variety of sources all over the body. The most important receptor being situated in the muscle themselves are the muscle, eyes, ear and shoulder joint. The pattern of posture. There are two patterns of posture as below: correct posture and faulty posture, that is good or poor posture. Good posture involves training your body to stand, walk, sit, lie so as to place the least strain on muscles, ligaments while you are moving or performing weight-bearing activities. Poor posture involves more strain on muscles and ligament. Types of poor posture in standing. Kypholordotic posture: an increased convex curve observed in the thoracic or sacral region of the spine. Lordosis refers to the normal inward curvature of the spine. When this curve is exaggerated, it is usually referred to as hyperlordosis. The pelvis is usually tilted anteriorly. Flat back posture. In this type of posture, there is a forward head, extension of the cervical spine, extension of the thoracic spine, loss of lumbar lordosis, and posterior pelvic tilt. Severe back posture. In this type of posture, there is a forward head, hyperextension of cervical spine, flexion of the thoracic spine, lumbar spine extension, posterior tilt of the pelvis, hip and knee hyperextension, ankle slightly plantar flexed. Scoliosis: a deviation of the normal vertical line of spine consisting of a lateral curvature and rotation of the vertebra. So this was all about posture. Stay tuned to my channel for more precise knowledge stuff and videos.